Let's now talk COVID vaccine. And as South Africa's vaccine drive gains momentum, the Health Ministry is reporting that the number of vaccine doses that have been administered has passed this 8 million mark now, with an estimated 3 million people fully vaccinated. The latest National Income Dynamics study, that's the NIDS Coronavirus Rapid Mobile Survey, has found that 1 in 5 South Africans still worry that COVID-19 vaccines are unsafe, but only 1 in 10 are very convinced of this. Now, their concerns range from believing that vaccine testing was rushed or vaccines could harm them because of some side effects. So to discuss more about where we are as a country in terms of COVID-19 response initiatives and some of the concerns around the COVID-19 vaccine, let's chat to Professor Adrian Puren. He's, of course, from the National Institute for Communicable Diseases, and he's the acting executive director. Great to have you. Thanks very much for being with us here on Morning Live.
Morning, and thank you, Jan, and thanks to your viewers as well. I hope this is an opportune time to talk about vaccines and the state of the third resurgence and why we need those vaccines.
Yeah, and I don't think there could be a better time because, you know, it is, we are obviously seeing an uptick in the average number of vaccines that are being given and the people being vaccinated. I mean, about 220,000 people per day are now being vaccinated. With this is a huge jump from what we had previously been seeing. I mean, there's still the hope that obviously 300,000 is what the president had wanted. I mean, he'd even said at one point 350,000. Are we still hoping to grow this number?
Yes, I think it's really critical because I think if you do the calculations and you want people to be fully vaccinated, especially those on the Pfizer vaccine, then yes, those numbers, reaching that number per day is really going to be critical for us to achieve the objective. And of course, we're going to talk about the fourth wave and what that would look like. So it's really critical that we really scale up the numbers and keep it consistent. I believe from Dr. Crisp that I made an announcement the other day that we have sufficient vaccine in the country. So let's hope that that continues and that provides us with a sustainable and expanded program.
So when we talk about we have sufficient vaccines, so the demand is there from South Africans to be vaccinated at the moment. I mean, with these numbers the way they are we seeing that South Africans in this particular age group that we're vaccinating, the demand is there?
Yes, I think particular age groups, and I think it's really about the access. And I think the Department of Health and government has really been trying to encourage people to vaccinate and really changing the conditions, I think, under which people can get vaccinated. In other words, I know we started off with the so-called EVDS, and that was the electronic system to register. But again, it's about access. And again, if particular age categories are not au fait or familiar with electronic systems or don't even have access to that makes it very difficult. But I think that there's a sensitivity to that, and I think it was recognized. And I think now you could actually walk in as well. So I think there are opportunities for people to be vaccinated, and there are also unique ways in which people are being assisted at different points to actually get vaccinated. So I think we should do everything in our power to make vaccines accessible and, of course, address any concerns that the public may have around vaccines.
You know, there's also a lot of skepticism out there, I imagine, that, you know, the latest National Income Dynamics study, Coronavirus Rapid Mobile Survey, let's have a look at this, quite a mouthful, found that there is increased public openness to accepting the COVID-19 vaccine. I mean, only 1 in 10 South Africans believe that the COVID-19 vaccines are unsafe. Now, what would it take to change the vaccine hesitancy?
I think it's really addressing those concerns immediately. In other words, we really need to engage with the public all the time with regard to demonstrating that these vaccines are safe and that they're efficacious or effective, in other words. And again, it's critical that we have data from our own country around the effectiveness of these particular vaccines and contrast those individuals who end up with severe disease in hospital versus those vaccinated and unvaccinated. And there's some really interesting data that has come out from the UK and the United States. And you can just see the really marked different trajectories in terms of the numbers of those who end up in our hospitals with severe disease, vaccinated and unvaccinated. There's a very distinct sets of populations, and I think this should really be the impetus, especially individuals who in the older age category, which I think we still have some work to do in terms of vaccinating that particular group of individuals, that they are the individuals on the older age categories with comorbidities. So the options are really around, do you really want to end up in hospital and have severe disease? Or is there an opportunity for you to avoid that? And how do you avoid it? Is by not only the non-pharmaceutical interventions, which will be with us for the moment, but also the presence of these really potent vaccines.
So that's an important point, because a lot of people have said, what difference does it make? I got vaccinated and I still got COVID. So, the vaccine doesn't stop me getting COVID. And that's an important point I think we need to emphasize.
Absolutely.
Is the point of having the vaccine is not that you are going to be immune to getting COVID. It is that it is going to stop you from perhaps dying and going to hospital. I mean, am I correct in that understanding?
An excellent point, Leanne. In fact, we don't emphasize enough that, in fact, there will be what we call, and I know this term is not the greatest of terms, so-called breakthrough infections. So the vaccines have a particular efficacy, so that means not everyone is protected, and there will be a proportion of individuals. It should really be a small proportion of individuals will have infections, but these infections should be mild. They should not be severe, and they should also, in the main, and I know the Delta variant is probably going to change some of this thinking, is that it will prevent forward or onward transmission. So severe disease is what these vaccines are geared towards. Those are the endpoints of these particular vaccines in the main.
You see, now there's another point that people do raise, again, saying, what's the point of getting the vaccine when there are so many variants? And there are some studies, and please let's talk about this, because this is what a lot of people are saying, and this is just the words that you hear in circles, and you're sitting it wherever, and people are just chatting and saying, why must I get the vaccine? There's so many different variants. What's the point? The vaccine doesn't even work against these different variants. I mean, you hear the Delta variant, and now there's rumblings of a Lambda variant, an Epsilon variant, the next one that comes, a new vaccine. So why should I even bother? There's another question for you.
Very important question. And I think, again, the evidence in the main shows that these vaccines, in particular, the work that has come through on the Pfizer, has shown that these vaccines are still effective. And in particular, the 2-dose. And that's why I wanted to emphasize the earlier point, is that it's good that we're reaching those particular numbers, but I would like to emphasize, especially in the context of the Delta variant, that those individuals who are receiving the Pfizer vaccine should actually have that second dose, because I think the studies, certainly from the UK, has shown the 2-dose vaccine regimen for the Pfizer is still highly effective. It's certainly reduced, but it still is effective. So I think it comes back to managing your risk. And I know that we're not all great at managing risk, but I think we just need to keep perspective about that risk and speak to those who are knowledgeable. Access the knowledgeable website or trusted websites, trusted individuals, rather than WhatsApp groups, Twitter feeds, and so forth. I would just be cautious around those if they're not trusted sources of information.
We're seeing younger and younger people being vaccinated. I mean, we're going to see on the 1st of September the vaccine being opened for those 18 years and older. That's the registration. In other countries, we're seeing 12-year-olds being vaccinated, and there's a lot of worry about that. Now, are there enough studies to see if there are any long-term effects? Because rightly so, parents worry for their children for the long-term effects that this vaccine may perhaps have. And again, let's just talk about the worry that this was rushed, because there is still the perception that this is a rushed vaccine. Was it rushed, and the long-term effects on perhaps younger individuals taking it?
So I think we need to put this in context. So especially the mRNA vaccines, I think the other vaccines have a more traditional route, if you like, because they were either whole vaccines or so-called vector-based vaccines, as they're called. But the mRNA vaccines, I think, has really been the focus of the so-called rushed approach. But there's been a long history around the mRNA vaccines. In fact, it concluded the work on the Ebola outbreak as well, and the development around vaccines. So mRNA vaccines have been around, and this has been the first and excellent demonstration of how effective this mRNA vaccine is. Again, I want to reassure the public that, in fact, and I know there's lots of swirling around the FDA, SAPRA, all these regulatory bodies. These are what are thought to be autonomous, independent bodies that assess the evidence, and if the evidence is credible, and the two main things that they look at is the efficaciousness of the vaccine and the safety. And based on the independent analyses, these have been shown to be quite safe and quite tolerable and quite effective. So I think I would like to reassure the public that the evidence is there. These are credible organizations, including our own South African Health Products Regulatory Authority. They really look carefully, and they involve the experts in the field to really assess what that data is showing and really make really considered opinions around that to come to the conclusion. So my sense is that it looks as if it was rushed. I think it was a remarkable feat, but that feat of reaching a vaccine that we can use is really based on a really sound scientific basis. It's not just a sudden switch.
You know, there have also been some people and quite a few instances of people saying, I have, in fact, a few people that I know of, and I'm seeing some people writing in and telling me their story as well. They went for the vaccine, and obviously, you know, you are told about the certain side effects that you may feel, but then it actually led to them getting COVID and getting very sick, not perhaps having the vaccine, but maybe they were exposed to the COVID or they had it before or something or other. But have you found that? I mean, does it bring on COVID? Is it, some people have said that they've had such terrible effects from this vaccine that, you know, they find it inexplicable and are trying to find reasons. So, you know, perhaps you can explain that as well.
Yes, so in the main, for the majority of individuals that receive the vaccine, it's a safe vaccine. There will be side effects, and some people do experience side effects to a marked degree. But in the main, these should really resolve within 72 hours to a week. And in fact, you can certainly take, you know, for example, if you're experiencing fever or pain at the site of the injection, then Panado, bed rest and so forth should resolve that. But you're quite right, if there are, and that I would think that it's really going to be a minor group of individuals. If those symptoms continue, then obviously it needs to be investigated. And again, as far as I'm aware, and again, SAPRA has not release these particular figures, I'm sure they will do so, is to give us a better sense of what it actually looks like. So yes, the anecdotes are really important, and I hope that they've been investigated. But my sense is that the vaccines should really be safe, and they should be tolerable. You know, you mentioned about the side effects. So those are the side effects of the vaccine. But remember, and there's been a recent publication, or soon to be a recent publication from South Africa, showing again that even here in South Africa, people are experiencing the so-called post-COVID sequelae of infections, and these can be long-term. And in fact, this is the so-called second epidemic. In other words, people who have experienced the actual infection and have outcomes around these particular, as a result of the infections, whether it be neurological or whatever, cardiac, for example. And these effects are sustained and long-term, possibly. And these are currently being investigated. So again, I think it's balancing that. Do I want the vaccine where I will be safe and protect against severe disease? Or if I do get infected and I'm in a particular age category with comorbidities, if I survive this, there's the possibility of so-called long-term COVID, or long haulers, as they're also called. So I think it's really balancing those particular outcomes.
All right, Prof, thanks very much for talking to us. I know there's lots more to ask, but I think we've given our viewers a lot of food for thought this morning. Professor Adrian Puren is the Acting Executive Director at the National Institute for Communicable Diseases, discussing more on where we are as a country in terms of COVID-19 response and speaking to some of those anti-vaccine perceptions.